The photograph was from 3 summers ago. Helen found it while organizing a drawer, her and her sister at a family reunion. Standing in the backyard, both of them in capri pants and sandals, squinting into the afternoon sun. She remembered the day clearly. She remembered the food, the children running on the lawn, the particular way the light fell that afternoon. What she hadn't remembered until she looked at the photograph was how her legs used to look. She set the photo down and looked at her own ankle, then picked it up and looked again. Something had changed. Something she couldn't name, couldn't measure, couldn't point to with precision, but something that was undeniably, unmistakably different between the ankle in the photograph and the ankle she was looking at now. She had been looking at fabric and texture and change for 40 years as a seamstress. She knew what a difference looked like, even when it was subtle, even when no one else had noticed, even when she couldn't yet explain what the difference meant. It took 8 more months, an unrelated dermatology appointment, and a word she had never heard before to finally understand what the photograph had been trying to show her. I want you to do something right now, if you're in a position to. Look at your ankle. The area just above the ankle bone and the lower 4 or 5 inches of your calf. Look at the skin there, its color, its texture, the way it sits against the underlying tissue. Now think back 5 years, 7 years, 10 years. Does it look the same? Or is there something different you have been unable to name, a slight thickening, a change in color toward brown or reddish brown, a firmness to the skin that wasn't there before? An area where the skin looks and feels somehow different from the skin on your upper calf or your thigh? If you're nodding, or if you're now going to look and you're not sure what you'll find, here is the thing most people never hear. That change has a name, a cause, and a very specific meaning about what is happening in the veins beneath it. It is not a skin condition. It is not a bruise that never healed. It is not simply the skin of someone getting older. It is a map, a visible record written in the tissue above your ankle of something that has been happening in your vascular system, in some cases for years, before it was visible anywhere else. Helen found that map in a photograph. By the time she understood what it meant, the map had been there for longer than the photograph suggested. Helen is 69 years old and lives in Mississippi. She spent 40 years as a seamstress, first in a factory, then from a workroom in her home. 40 years of looking closely at fabric, its weight, its drape, the way light moved across texture, the way a subtle change revealed itself only to someone who knew how to look. She retired at 64. She kept the eye. The change above her ankle had been there, she estimated, for at least 2 years before the photograph made it undeniable. It had happened so slowly it fell below the threshold of daily attention. The skin above her left ankle had thickened slightly. Not dramatically, but up close, in good light, it had taken on a brownish tint and a texture different from the skin 2 inches higher on her calf. Firmer, less yielding when she pressed it. Her right ankle was beginning to show the same change, less advanced. She mentioned it to her primary care physician at her annual appointment. He looked briefly and said it was probably hyperpigmentation, common in older skin, nothing to worry about. She accepted this. She had accepted a version of this explanation for 2 years. But the seamstress's eye kept returning to it, kept finding the difference between what the doctor had described and what she was actually seeing in good light. 8 months later, she went to a dermatologist, not for the ankle, but for a spot on her forearm. At the end of the appointment, almost as an afterthought, she mentioned the ankle. The dermatologist looked, then looked again with more attention, then asked how long it had been there. Helen said she thought about 2 years, maybe more. The dermatologist said a word Helen had never heard: lipodermatosclerosis. Here is what that word means and why it matters more than hyperpigmentation. Lipodermatosclerosis, LDS, is a condition of the skin and underlying fat tissue of the lower leg, caused by chronic venous insufficiency, the progressive failure of leg veins to return blood efficiently to the heart. When the valves inside the leg veins weaken, as they do in a significant proportion of adults after 60 blood pools in the lower leg, the pressure of that pooled blood forces fluid and red blood cells out of the capillaries into surrounding tissue. The red blood cells break down and their iron-containing pigment deposits in the skin, producing the brownish-reddish discoloration Helen had been seeing above her ankle for 2 years. Simultaneously, chronic inflammation triggers tissue fibrosis. The skin and underlying fat thicken and harden. The skin loses its normal yielding quality. In advanced stages, the lower leg takes on what is described as an inverted champagne bottle shape, wider above the ankle, narrowing below as the tissue contracts. This was why Helen's ankle felt different from the skin higher on her calf. Not aging. Tissue that had been responding for years to pressure and inflammation. It was not designed to sustain indefinitely. Stop, because this part matters most. Lipodermatosclerosis is not primarily a skin condition. It is a warning, a visible sign that venous insufficiency has been present long enough to change the tissue, and that without intervention, progression continues toward venous ulcers, open wounds that are among the most difficult in medicine to heal. A 2020 review in the Journal of the American Academy of Dermatology found that LDS precedes venous ulcer formation by an average of 3 to 7 years in untreated patients, making it one of the most actionable warning signs in vascular medicine and one of the most consistently missed in primary care. 3 to 7 years of visible warning. Helen had been in that window. The dermatologist had caught her inside it. The dermatologist referred Helen to a vascular specialist the same week, direct about the reason. The window between an LDS diagnosis and a venous ulcer is clinically significant, and what happens inside that window determines which side it closes on. The vascular specialist performed a duplex ultrasound of Helen's leg veins. The results showed reflux in the great saphenous vein, the valve failure that had been allowing blood to pool, generating the pressure, driving the tissue changes Helen had been watching for 2 years without knowing their name. The specialist said something Helen repeated to me exactly. "You caught this at the right time. Not the perfect time, the right time. Perfect would have been 2 years ago. But right is still very good." Helen thought about the photograph, about the drawer she'd been meaning to organize for months, about the seamstress's eye that had refused to accept the simple explanation because the texture was wrong. The color was wrong. The change was specific in a way that general aging is not. 4 interventions targeted at the venous insufficiency driving the tissue changes and at slowing the progression that had already begun. The first was medical-grade compression, worn consistently from morning to evening, every day. Not support socks. Medical-grade graduated compression prescribed at the level recommended by her vascular specialist, reducing pressure in her lower leg veins by replicating externally what her failing valves could no longer provide internally. Within 3 weeks, The evening heaviness in her left leg had reduced measurably. The second was leg elevation above heart level, 20 minutes, twice daily. Not on a footrest, above the chest, using stacked pillows. This position drains accumulated fluid from the lower leg tissue and reduces the hydrostatic pressure, driving further fluid leakage, morning and evening, consistently. The third was horse chestnut seed extract, the natural compound with Cochrane-reviewed evidence for chronic venous insufficiency. Essen, its active component, has been shown in controlled trials to reduce lower leg swelling and improve venous tone. 1 capsule daily with a meal as a complement to compression and elevation. The fourth was daily calf activation, 30 ankle rotations and 30 calf raises every 45 minutes during prolonged sitting, maintaining the calf muscle pump activity that Helen's failing valves could no longer rely on alone. 4 interventions. The LDS did not reverse. Established tissue changes rarely do completely, but the progression slowed. The inflammation reduced. The discoloration stabilized rather than spreading. And the vascular specialist at the 6-month follow-up said the word that had been the standard she was working toward: stable. Stable. Not resolved, but stable inside the window on the right side of it. Helen went home and put the photograph back in the drawer. She looked at it for a moment before she closed it. The reunion, the backyard, the afternoon light, the legs she hadn't been paying attention to. She closed the drawer and decided she would keep paying attention from now on. 4 things starting today. Look at your ankle in good light carefully. The area just above the ankle bone and the lower calf. Look for brownish or reddish-brown discoloration, skin that feels firmer or thicker than the skin higher on your calf, or an area where the texture is different from what you remember. If you see it, tell your doctor specifically what you see and ask whether a vascular evaluation is appropriate. That conversation is worth having. Compression, medical grade, graduated, worn from morning to evening. Ask your doctor for the right prescription level for your situation. Consistent compression is the most evidence-based thing you can do for venous insufficiency, and most people who need it are not wearing it. Elevation, 20 minutes, twice daily, above heart level. Not elevated, above heart level. The difference in drainage is significant. Morning and evening, consistently. Calf activation every 45 minutes during sitting, 30 ankle rotations and 30 calf raises. The pump your veins need when their valves can no longer do the work alone. Helen told me something about the dermatology appointment, the one she had booked for a spot on her forearm, the one where she mentioned the ankle almost as an afterthought. She said, "I almost didn't mention it. I'd almost didn't mention it." I thought I was going to waste her time. But I showed her anyway, because I'd been looking at it for 2 years and something in the way it looked just wasn't right to me. And I needed someone to look at it the way I look at things. The way I look at things. 40 years of looking at fabric had taught Helen that change has a texture. That difference is visible if you allow yourself to see it rather than explain it away. That the most significant changes are often the quietest ones, the ones that happen so slowly they fall below the threshold of daily attention until a photograph, or a careful eye, or an almost afterthought in a dermatologist's office pulls them into focus. Her ankle had been changing for at least 2 years before the photograph made it undeniable. It took 8 more months for someone with the right knowledge to look at it the right way. If you looked at your ankle while this video was playing and something felt different, something you haven't been able to name, something your doctor has explained away, but that your own careful attention keeps returning to, don't dismiss it. Leave a comment, 2 or 3 words. Tell me what you've been looking at. Because someone will read your words today who has been looking at the same thing and telling themselves the same convenient explanation. And your words might be the moment they decide to ask someone to look more carefully. Hit the like button if Helen's story reached you, and subscribe to Strong Legs, Independent Life, every Tuesday and Saturday at 11 a.m. Because some things only become visible when someone finally looks at them the right way. Keep smiling, keep moving, and never forget, you've got this.